Hi, everybody. This is Mike Hirsch, the Chief Pandemic Information Officer and Medical Director for the Division of Public Health for the City of Worcester, back with another edition of Stay Connected with the Worcester Senior Center. And thanks for having me back. Every month we've been chatting about a lot of things, but mostly COVID, right? This is no exception. And this has been a busy news day for COVID. As we're recording this, it's August 16th. But what we are going to kind of go over are some preliminary information that we got from the CDC today about how they're going to handle COVID moving forward, okay? So first of all, most of you in the senior population here in Worcester have been wonderful about getting your vaccinations. Whether you got Moderna, whether you got Pfizer, whether you got Johnson & Johnson, our statistics show that people over the age of 65, we are right about 84% of total vaccination, which is a great number. And in the older folk, even 75 and above, it's closer to 92%. So there are not many of you out there that are unvaccinated. If you are unvaccinated, I urge you, please get vaccinated. If you can't get to a vaccination place, we're blessed in Massachusetts with a system where if you go on the www.mass.gov, there's a homebound site where you can identify yourself as somebody who can't come out of their home to get the vaccination, and they will send a team to vaccinate you right in the comfort of your home. So really, there aren't many excuses for not getting the vaccine. And why it's so important now is, about the end of June, we really thought we were sailing. We were down to having one or two cases a day in Worcester, and the vaccine program that at that time had vaccinated about 50% of the population here in Worcester seemed to really have done the trick. But something changed, and what that was the virus mutated. It went from its traditional strain to what now is being called the Delta variant. The Delta variant started in India, and it swept through that country. There was very little vaccination in that country at the time. Only 7% of the country was vaccinated, and the Delta variant went haywire. It loved that atmosphere because it could propagate, it could build up 1,000 times the viral load of the original virus in your nose. It was 20 times more transmissible than the traditional early version of the COVID variant. And it was getting up there in transmissibility, and many of you in that senior group like me, we remember what it was like to get the chicken pox. I got the chicken pox when I was a kid. It spread like chicken pox, which is only the second most spreadable of all those viral illnesses behind measles. So the COVID variant hit our shores in June, and at that time, it was only about 1% of all of the COVID infections that we were seeing. But it spread so rapidly that it ended up being now 92 to 95% of all the cases that we're seeing are the Delta variant. So how did it spread so much? It spread because in the South, there was huge swaths of people that were not getting vaccinated for all different kind of reasons. Some were just hesitant, some were anti-vaccine, some were politically against the government telling them that they had to get a vaccination. Some were worried that the FDA hadn't given the vaccines the final approval. It was only under emergency authorization, and that was their excuse for not getting vaccinated. When a big group of population is unvaccinated, the virus goes wild. And then what we subsequently learned, and this mostly came out of right here in our backyard, Provincetown, Massachusetts, over the 4th of July weekend. If you get a lot of people together, whether they're vaccinated or not, in the atmosphere of COVID variant Delta, it'll spread. So there were 1,000 breakthrough cases of COVID that came from the gatherings of 4th of July weekend in Provincetown. So a lot of people were saying, oh my God, why would I bother getting vaccinated if I'm going to get COVID anyway? Well, here's the deal. There are COVID cases and there are COVID cases. The COVID case you get after you've been vaccinated is very, very mild. 92% of the people that got those breakthrough infections in Provincetown never went to the hospital. Only 6% did, and less than 2% died. Now, think about the math here, okay? In Massachusetts, there have been 10,000 breakthrough cases overall, besides the 1,000 that happened in Cape Cod. 10,000 out of 4.5 million people vaccinated. That's a very, very, very small number. And what it tells us is that the vaccine is absolutely doing its job. It never guaranteed that you would never get COVID with the vaccine. It only said you're not going to get a bad case of COVID if you get it. So with the numbers that we had from Moderna and from Pfizer, we knew there was about a 5 to 10% chance that it could still result in you getting a COVID infection. But if 92% of the time you don't have to go to the hospital, that's a great goal to have been met. And we're not seeing the hospitals now in Massachusetts flooded with cases. The numbers are going up, that's true. Right now we're seeing roughly, instead of 2 cases a day in June, we're seeing somewhere between 40 and 50 cases a day in August here in the city of Worcester. But the hospitals are not overwhelmed. There are only, as we speak today, 16 patients at UMass and 2 patients at St. Vincent's with COVID, and 95% of them are in the unvaccinated people. So the unvaccinated person right now is at great risk for having contracted COVID. And because the seniors, like all your friends at the senior center, are mostly vaccinated, we're not seeing that age group come into the hospital. What we're seeing is younger people, because it's the younger people that just haven't gotten the vaccine. Between the ages of 12 and 40, the vaccination rate is about 35%. That's way too low. But these are the people that feel, well, I'm not going to get sick. I'm healthy. I'm not going to get sick. With COVID variant Delta, those people will get sick. So we've got to encourage your kids, your grandkids, to get the vaccine when they're eligible. And if they're over the age of 12, they are eligible. And there's so many avenues to get it now. Back when you were getting it in January and February as a senior, everybody was calling, clamoring. You couldn't get online to get the vaccine. It was very, very difficult. Now, no way. It's very easy. There are clinics over at the Mercantile Center. All of the drugstores are giving it out. There are special mobile clinics that the Department of Public Health are doing under the leadership of Dr. Maddie Castile. There's almost no way that I could think of that you could not get a vaccination. So that's where we have to start. If you don't have the vaccination, you are at big time risk right now with this variant. And if your family doesn't have it, they shouldn't be hanging out with you because you could still get a breakthrough infection. And the other thing we learned from Cape Cod's experience at Provincetown is that unlike what I told you last month, and this is new knowledge. It's not like I've been trying to wiffle waffle on my opinions. We just learn stuff all the time when these new mutations come out. When you are a vaccinated person that gets a breakthrough infection, we didn't think before that you could spread it, but you can. And that is why you've seen changes in what we've recommended for wearing masks. So let's talk about masks for a second, okay? Remember last year. Remember when all we had, before there was any vaccine, to fight off the virus were the 3 W's. Wear your mask, watch your distance, and wash your hands. The 3 W's did a very, very good job. Of course, there were people that didn't believe in it, and they flaunted it, and they would go into stores, and where everybody else was wearing a mask, they wouldn't wear a mask, and there'd be confrontations. And there were certain churches and certain organizations that said, I'm not wearing a mask, it's my body, my health. I think we kind of got over that now. I think we understand that the individual health choices that we are making are not just for our own benefit, but for the benefit of the whole community. So when you decide to get a vaccination, you're not just helping yourself, you're helping everybody else. And that's the spirit that we've seen in Worcester consistently. So now, after May 29th, when all of the restrictions on COVID were kind of lifted, we were very optimistic. And June went beautifully. And then we started to see the Delta variant numbers going up. 10%, 12%, 30%, 45%, and now, as I said, 90%. And the higher they went up, the more infections we're seeing, the more breakthrough infections, and the more infections in the unvaccinated. And here's the deal with these vaccines and the variants. If you're unvaccinated and you get COVID, you're not just getting the infection for yourself. What you're allowing the virus to do is make thousands and thousands of copies of itself, because that's what's hanging out in your nose and mouth and why it's so transmissible. Most of those copies are exact copies. Some are terrible copies that never survive and they just die. They don't have any import. But every once in a while, there'll be a copy that is more dangerous than the original. And that's how Delta came about. That's how we got from the original to Delta, because the copy process is not precise, and the copies that get made sometimes are worse than the original. Now there's another variant that's been identified in Peru called the Lambda variant. Now the Lambda variant, we haven't seen a lot yet, but we said the same thing about Delta. And the difference between the Lambda variant and the Delta variant is the vaccine works very well still against the Delta variant. But on the surface of the virus is a protein called the spike protein, and that's the protein that the vaccine trains your body to attack if you get an infection from COVID. And that's why it's so effective. On the Lambda variant, there is unfortunately a new type of spike, and it looks like the current vaccines are not as effective against that variant. So what does this all mean? I mean, you sitting in your house in Worcester can't prevent the variant from coming here from Peru. That's another thing we've learned. These viruses are traveling in the air and they're coming. We know they're coming. But what we can do is if we get everybody vaccinated, it will be very, very unlikely that one of these new mutations, new variants, will pop up because the virus is going to die out. And we can't make the Delta variant die out if 30% of the population of Worcester is still unvaccinated. And that's where we are. We've got to get that number down. So, what are the biggest challenges ahead? Well, I bet you know it without me telling you. School. The kids between the ages of 5 and 11, none of them are vaccinated because the FDA has not authorized the vaccine to be safe yet for kids. The trials are going on. We think they're going to get there by November, but it's not around the corner, and that's a lot of time. The kids between 12 and up who are in our secondary schools, middle and high schools, they're eligible. They should be getting vaccinated, but only 30% of them have gotten vaccinated. So 1/3 are vaccinated. And unfortunately, the Department of Elementary and Secondary Education has insisted that this year we're not going to have a virtual school option. People are going to go to school. There's no stay at home and watch on YouTube or on your Chromebook. So the classrooms are going to be very crowded and the kids are going to be very tight. And if in the high schools, for example, 70% are unvaccinated, and in the elementary schools, 100% are unvaccinated, that's a test tube to have a COVID outbreak. And we have hoped that we could appeal to people to get the vaccine, at least in that 12 to 18-year-old group that's in high school. And there may be coming down the pike what's called a vaccine mandate. Like the other viruses that you have to show when you go to school, you've been vaccinated against. You have to show that you were vaccinated against measles, mumps, and rubella. You have to show that you were vaccinated against smallpox. And no one seems to raise much of a fuss about those. They're raising a fuss about this particular vaccine, again, because it hasn't gotten the final FDA approval. But we think that is coming. Maybe by the end of August, we will have that official approval, and then excuses go away. Then if you're not getting the vaccine, it's because you are not being a team player. And that's what we need to fight. We have to have people on our same team. Otherwise, we're going to get into much worse problems with continual new variants appearing, spikes everywhere. No one's happy about having these mask mandates or vaccine mandates, but this is what public health is about. Believe me, in the 1918 pandemic, if there had been a vaccination against the flu, people would have gladly taken it. 50 million people around the world died during that pandemic. 625,000 Americans died during that pandemic. We have now gone over that number here during this pandemic. And it's a shame. And it shouldn't have been politicized. There's nothing political about this virus. It will attack a Democrat. It will attack a Republican. The one thing that we can hopefully agree on is that we can't continue to live this way, worrying about, are we going to lock down? Are we going to all go back inside and not come out of our homes? We can't live that way. I think that the COVID virus is here to stay in some way, shape, or form. It's probably going to be here kind of like the flu. And that's what I wanted to bring up as our next thing. You know, every year we recommend strongly that you get a flu shot. And when you get the flu shot, you don't eliminate the chance that you are going to get the flu, but you're going to have a milder case of the flu if you get the flu. I think that's what's going to happen with COVID. And just in the last 2 days, the CDC has announced, number one, that people with immune compromise should get a booster shot, because the original shots that were given out in January and February have given you a certain amount of immunity, but it's starting to wear off. They've seen now the numbers, they've seen the level of antibodies, they want to boost them up. So these immune compromised patients are a special group because their antibody levels are low to begin with. They can't mount the same defense as other people against the virus. So if you have HIV, if you're on chemotherapy for cancer, if you have underlying lung disease, those are the type of people that will probably be first in line for a booster shot. Today, the Biden administration announced that they want all Americans to get boosters. They haven't announced exactly how. They want the booster process to start 8 to 9 months after your original injection, and that would calculate out to late September, early October. We probably, and I'm just conjecturing here, no proof, are going to go in the same tiered way, the sequential way that we went back in January. January 11th were the first days of vaccination here in Worcester. And we started with the long-term care facility people and their health care workers and the first responders, fire, police, EMS. And then we went to the 75 and older, then we went to the 65 and older, then we went to people with one comorbidity like diabetes, heart disease, lung disease, and then it was vaccines for all. Now, in those days, there wasn't enough vaccine around. Now we got plenty. So maybe the Biden administration will say, first come, first serve, just come. Because we have a lot of vaccine around. And it's now being given out in doctors' offices, it's being given out in medical centers, it's being given out in pharmacies. It's not just at these emergency distribution centers like the one we had at the Worcester Senior Center, your home, and also, eventually at Worcester State University. So that's part of our homework. As soon as I get done taping this, I'm going to a meeting about how we could stand up some booster operations to make sure that we don't miss anybody that can get a booster, that wants a booster. And how long will the booster give you immunity? We don't know. We think it might give you at least another 8 to 9 months. Eventually, they're going to get it right so that it will be like a yearly thing, like the flu shot. And we also know now, which we didn't know last year, that you can give a flu shot and a COVID shot at the same time. It won't interfere with each other, and that will make it easy. We'll just do like double whammy clinics where you get both injections at the same time. So this is all developing news. It's, we had a school committee meeting last week where Superintendent Benenda and the school committee under Joe Petty, our mayor, they were able to get a mask mandate passed. So all the kids in elementary and secondary schools in the Worcester Public Schools are going to be wearing a mask indoors. You probably have noticed that many of the big box stores like Walmart and Lowe's and Home Depot, they're already mandating masks indoors. And masks indoors are the smart way to go if you're going to be out and about, because it's close quarters. This Delta variant, very, very transmissible. I think it's the safest thing to if you got to be indoors in a crowd, especially if they're not your crowd. Like if you know everybody in your living room is vaccinated, you don't have to wear a mask. But if you don't know that, if you've got strangers or new people that have come from out of town, wear your mask. Outdoors, so far, we don't think that we need to wear masks. And that could change, but so far, the fact that Massachusetts has close to 74% vaccination is great. We're the number 2 state in the country behind Vermont. And I hope we can drive those numbers even further up, because we need to get out of this thing. And when you see what's happening in Florida, in Louisiana, and Texas, where the vaccination rates are super low, and where they also have some very odd politics behind this, where people are being told that if they mandate a mask in a school, they'll have their schools defunded. I mean, this is insane. And I think that we're very, very lucky that the city manager and the mayor and Superintendent Benenda were willing to be more stringent, more tough on students than the Department of Elementary and Secondary Education required. They didn't require masks for the vaccinated students, but you have to know something about kids. I've been a pediatric surgeon for 40 years and a dad too. And I know that if you put a bunch of kids in a room with a mask and others without a mask, there's going to be a battle about that. They're going to tease each other. Why are you wearing a mask? Why aren't you wearing a mask? And with all of the potential for bullying and cyberbullying, it's a no-win situation to, separate the kids like that in school. It's all or none. And if you do none, you're just going to have a lot of sick kids. If you do all, everybody is under the same rules of play, and it's much more safer. So we have to use our heads and not our hearts, and not our this anger gene that seems to have come out now. And there are even reports now that there are a lot of vaccinated people who are very resentful of the unvaccinated people because they got the vaccine thinking there would be a benefit to it. And there was for a little while in June and beginning of July, and then it got taken away because the unvaccinated people are being stubborn. So there's a lot of resentment around. There's a lot of anger around. There's a lot of mistrust around. People are saying, oh, the CDC is changing its mind every other day. It's the nature of this virus. It's mutating. And when it mutates, we have to change our response. So I would still urge you to trust in the science. I tell you quite honestly that City Manager Augustus and Mayor Petty, do not let me come to these kind of sessions unless I swear that I am not going to tell you anything that is not based in science. So what I'm telling you is based in science with the latest information we have. We're so lucky in Worcester that we have Dr. Robert Finberg at UMass, who's one of the developers of the vaccine. We have Dr. Abraham at St. Vincent's Hospital, Dr. Ellison at UMass, who's running a lab that's helping to identify what strains are out there in Worcester. I mean, we have a tremendous brain trust here. And then we have somebody like Dr. Castile, who's going out and knocking on doors, doing everything she can, setting up shop in front of grocery stores and in front of parishes and trying to get the vaccine to the people. I mean, these are angels among us. And I'm not that, but I'm just telling you, we are very fortunate in Worcester with the brain power and the depth of commitment to public health that we have. So I would urge you, those 3 things I would recommend right away: wear your mask indoors, no questions. Get a vaccine if you haven't gotten the vaccine yet. And if you have gotten the vaccine, make sure that you are watching the news and figuring out where can you get your booster shot, because you're going to be amongst the first in line to be eligible to get your booster shot. And we can hopefully learn from all the mistakes we made in January, February when the vaccine wasn't plentiful. Now we'll be able to, I think, make it much easier on you all to get the vaccinations that you need. And trust the science. It's there, and it's been very, very helpful. We would be in a much, much worse place if we didn't have these vaccinations on our side. So the last thing I want to say is we're still in the summer, right? And the climate has been interesting, very wet July, some heat waves here in August. Make sure you're keeping yourself hydrated, whether it's to prevent the heat issue or COVID. You need to be hydrated. It's a very, very dehydrating situation to be out in 90-degree weather, or if you have symptoms of COVID. And if you have symptoms of COVID, get yourself tested. Don't attend the senior center with cold symptoms. Don't go to your kid's house or your grandkid's house with COVID symptoms. Get yourself a test. There are some new tests that CVS has, which are instant tests. You can do them at home. They're much more accurate than the ones that were being done in the beginning of the pandemic. And they're going to be widely available. And that may be the easiest way of keeping the spread much more contained. So the last thing would be to remember this is also mosquito season. With the wet July we had, a lot of the ponds, a lot of the little brooks and rivulets are full. There are stagnant areas where water has been sitting, and around the city there's always spare tires around with water in them, or little barrels, sometimes bird baths. This is a place where the mosquitoes propagate. So today, just today, for the first time, there was a positive West Nile mosquito identified here in Worcester. And so we're making arrangements with the Central Massachusetts Mosquito Control outfit to do a spraying in that area. You'll be getting notification about that. It's not super toxic stuff. This is not DDT that they're spraying. They're spraying another chemical that is much safer, but they would recommend that when the spraying happens that you don't go outside for about an hour, that you close your windows, don't let your pets outside during that time, just to keep them from being bothered by the spray. So have to keep aware that the rest of the summer is happening even amidst the COVID problem. So I think that's the main messaging today is all about the COVID virus, about the variant called Delta, about the importance of getting vaccinated, about wearing your mask indoors, because that's a very important protector, whether you're vaccinated or not, and just being sensible. And you know, you're the backbone of common sense for our community, because we always look up to our elders to get the right information and the best advice. So if your family comes to you and says, you know, this is the worst thing ever, tell them about your experience during World War II. Tell them about how tough it was in Korea, or in the atomic age with the Cold War raging, or tell them about how terrible it was in Vietnam. Tell them that we have gone through worse times, because people think that this is the worst thing in the world, that they're stuck in their homes with, God willing, enough food and water and Netflix. It's not as bad as what you have already gone through. And that wisdom can be passed down to your kids and your grandkids so they get some perspective. Come on, we can do this. We can do this together. And I think we have to support the mayor and support the superintendent of schools, support City Manager Augustus. They're making hard decisions all the time, and they're, again, supporting public health. That's what it's about. So thanks a lot, and we will look forward to talking to you again in September. Be safe. Please don't hesitate to contact the Worcester Department of Public Health for any questions that you have. You can get us at www.worcesterma.gov. And thanks for spending a little time staying connected here at the Worcester Senior Center.